Okay. So guys, no, this will be the last topic for today. Okay, we have your subcutaneous mycosis. So obviously, these are fungal infections, no, causing lesions. Okay, dun sa subcutaneous tissue po natin. So under this, okay, classification, we have four types, no, of mycosis. We have your sporotrichosis, chromoblastomycosis, phaeohyphomycosis, and your mycetoma. Okay? Guys, no, you have to remember most of the microorganisms causing your chromoblastomycosis, your pheo, and your mycetoma, they are demacious fungi. So in addition dun sa diniscuss natin kanina sa superficial, we have the causative agent of your tinea nigra, which is your Hortea wernicke, and that of your Black Piadra or yung Piadyara hortei natin, sila ay mga demacious fungi. Okay? Except for some. For example, in mycetoma, may hyalin fungi dito. Pero most of them, they are demacious. So let's start, okay, with our discussion. So first we have here, no, an introduction to your subcutaneous mycosis. So yung mga fungi po causing these infections, okay, they are usually normal, okay, residents of soil and sa mga vegetation. So yung example sa forest, 'di ba? Sa mga areas where we have lots of plants, sabayin nyo na lang, for example, you have lots of ornamental plants, no? Pwede sila doon, okay? So, ang mode of transmission, just like yung ibang mga na-discuss natin, is through traumatic inoculation to skin or subcutaneous. Halimbawa, natusok ka, okay? With, for example, plant thorn or material infected, no, with soil harboring these microorganisms, okay? O sa forest, halimbawa, natusok ka ng kahoy with the microorganism, so pwede kang magkaroon po ng mga type ng infections na to, okay? In general, do not forget for your subcutaneous mycosis, they are granulomatous, okay? They cause granulomatous infection, okay? And nag-e-expand po yan or lumalaki kasi na inoculate, no, yung mga fungi sa ating subcutaneous tissue, and eventually they cause no expansion or lumalakas sila, like they spread, okay? Nagkakaroon ng hyphal invasion. Ni-invade ng mga hyphae po nila yung mga tissues hanggang lumaki ng lumaki yung kanilang sakop, okay? So in rare case, they become systemic. Okay? Minsan napupunta sila sa blood din, okay? And may cause now life-threatening diseases. So, first of this disease, okay, classification is your sporotrichosis. Your sporotrichosis is caused by your fungi, Sporotrich schenki. Do not forget, your Sporotrich schenki is a dimorphic fungi. Pag sinabi po nating dimorphic fungi, it has no um, it has its mold form and yeast form. Okay? So, yan yung Sporotrix schenki or schenki. So, please take note of the spelling. Okay? So, your sporotrichosis, guys, is also known as your gardener's disease or your rose gardener's disease. Okay? So, again, it's characterized by chronic granulomatous infection that usually no spread, okay? At minsan in-involve niya even your lymphatic system and the nodes. So, guys, wait lang ha, saglit lang. I have a call from the sa school. Di kasi ako nag-report ngayon dahil hindi okay ang internet doon. Wait lang po ha, saglit lang. Okay. So, sana nga tayo. Ayan. So, your sporotrichosis, okay, it's also known as your Rose Gardner's disease. And again, sabi natin, minsan merong lymphatic involvement, even the lymph nodes. Kaya dun sa lesion, minsan meron tayong fluid na lumalabas, okay? Because of the drainage, okay? So, etiologic agent, again, it's your Sporotrich schenki. And don't forget, it's a dimorphic fungus. Okay? Saan siya nakatira? Sa grass, okay? Mga dadamuhan, okay? Sphagnum moss, roses, okay? And horticulture plants. Or alam niyo yung pader? Have you tried observing yung pader na luma, especially those that are not painted? Di ba minsan guys may nag-grow na moss sa pader? You know that?
Yes,
Yung
ma'am.
pader minsan 'di ba nagi-green siya gano'n. So sometimes, we can also see them sa mga areas po na 'yon, okay? Kaya nga yung mga hiking, yung mga mahilig sa yung mga plantita, yung mga nagha-hiking, you have to protect yourselves, okay? Avoid 'no, na magkaroon ka ng, I mean, you be injured, okay, by these plants, okay? Or matusok ka ng mga thorns nila, like for example, roses, kasi baka merong Sporotrichia po 'yon, okay? So there's a mode of transmission, traumatic implantation by thorny plants or inhalation. Usually pag inhalation yan, ang kinukos niya hindi na skin lesion. Nagiging systemic like it cause now pulmonary sporotrichosis. So sa lungs. Okay? Susceptible hosts are individuals working with woody or thorny plants or those no with contact in contact with vegetation and soil. So common example yung mga forest rangers natin, yung mga nagtatrabaho sa DENR, 'di ba? So they do that kasi they count trees, 'di ba? Ganun. So na-expose sila, okay? Sa mga areas na madaming plants, halaman, ganun. O kaya yung mga plantita natin, okay? So yan yung mga example ng susceptible sa infection with your sporotrichosis. So your Eschenki, okay, grows well in your routine agar and at room temperature. So in your culture media, the colony appears to be a small white to cream color, okay? And sometimes they have this dark brown to black leathery consistency, especially pag nag-age na or medyo old na yung mga colonies natin. That is their mold form, okay? In their yeast phase, okay, they're inhibited on antibiotic media. So what we use to grow them is your brain heart infusion agar at 37 degrees Celsius, and they appear to have white cream to tan color. Okay? So that's for your Sporotrich schenki. So here's a picture, okay, of your Sporotrich schenki. So sabi natin kanina dito, yung kanilang description, no, it's membranous, okay, yung itsura po niya and wrinkled, okay? And sometimes pag super matagal na, okay, yung ating colony, they become leather-like in consistency, okay? So that's your Sporotrich schenki. So morphology, for the microscopic morphology naman, pag tinignan po natin sila, yung kanyang mycelial form or mold form, it shows hyphae with pyriform conidia. Okay, kamukha nung kanina, di ba, tear-like. Okay, so this one is also pyriform. And they usually no are found in cluster sa dulo ng ating conidiophore. So this is your hyphae. We call that your conidiophore. So minsan dikit-dikit sila dyan, they form cluster and they show this floweret arrangement. So don't forget, Sporotrich schenki, rose gardener's disease, rose, it's floweret. Okay? Floweret arrangement. And for the yeast form, they are usually elliptoid. So tapered yung kanilang yung ends nila, okay? So they are cigar-shaped yeast or fusiform. Okay? So minsan we can grow no yung ating mold form to become your yeast form. That's by incubating our colonies in your medium with blood and 5% carbon dioxide for 1 to 5 days. So we can transform the molds, okay, or mycelial form into the yeast form with the use of your blood and carbon dioxide containing medium. Okay? So again, floweret arrangement in your mycelial form. Don't forget that. And for the yeast form, it's sugar shaped. So this is the appearance po of our Sprotrix schenki. We can see here floweret arrangement, okay, of the conidia. Okay, and then here are the elliptoid yeast cells or cigar-shaped yeast cells. Okay. Okay, so of course, naalala nyo kanina sa trichophyton natin, we have your trichophytin, the antigen that cause no hypersensitivity reaction. Meron din sa Sporotrix. We call it your sporotrichine. Okay? So it also cause now delayed skin reaction, okay, dun sa mga pasyente exposed to this type of antigens. Okay, so next we have your pathogenesis and clinical findings. Guys, wait lang ulit ha. Sa school to, wait lang po. Or yung special order na lang ang ilalagay niya sa harap? Yun po ba yun? Ibig sabihin no, ma'am? Ah, so, ah, sa harap, ma'am, is yung corrected na dun sa special order. Po. Thank you, ma'am. Okay po, sir. Thank you, Mother Nine. Thanks po. Bye-bye po. Sige po. Okay. So, for pathogenesis and clinical findings, okay, we can see no presence of conidia or hyphal fragments dun sa skin, okay, where we have the lesions, okay? So usually sa extremities kasi madalas lang naman 'di ba pag nasa mga halamanan, so yung paa or kaya kamay natin yung natutusok, okay, or nasusugat. Okay? So that's your lymphocutaneous sprotrichosis. And usually guys, no, it has no subcutaneous nodules, madaming nodules at merong parang mga abscesses, okay, dun sa nodule na yon. Okay? And if we're going to get biopsy of the skin lesions, stain po natin siya, for example, with your H&E, makikita natin yung splendor Hopley phenomenon. So, dun sa yeast cells natin, meron siyang parang mga radiations, okay? So, eosinophilic materials that radiate from the yeast cells. So, para siyang asteroid body. Okay, that's in your sprotrichosis. So, nakikita natin to sa H&E preparation natin. Okay? So do not forget that your sporotrichosis sometimes, okay, appear to, or the lesions in sporotrichosis similar to your lesions in Mycobacterium marinum and your cutaneous leishmaniasis. That's why we do differential diagnosis. Anong ibig sabihin? I-check natin if we believe that it's a fungal infection, then we request no for culture. And if there's growth, then probably that's what's causing the infection is your sporotrix. Okay. But if there's no growth, okay, and after using maybe serological tests for bacterial infection for your Mycobacterium marinum or leishmaniasis at dun siya nag-positive, then we can say that the lesion is caused by your Mycobacterium marinum or your leishmaniasis and not, okay, caused by your sporotrichos, Schenki. Nagigets niyo po ba yung ibig kong sabihin? Thumbs up if nakuha ninyo yung ibig kong sabihin. So, ganun, yung ginagawa sa differential diagnosis, they look into the presentation, ano yung tsura ng lesions, kung pareho man, and then they cannot determine, okay, which is causing the infection, then we can run laboratory tests, okay, to identify. Eh kung sa skin scraping pa lang or lesions, may nakita ka ng hyphae and your yeast cells, then we can say it's an infection caused by a fungus. So we just have to identify if it's really Sporotrix. Okay. So here, no, is a picture of the lesions. So they are nodules. Okay. Puno. Pero this disease is usually self-limiting. Minsan gumagaling din kaagad yung pasyente natin. Okay? So, and this is now the histologic section. Kung maalala nyo kanina yung sinabi natin, di ba, merong appearance ng mga asteroid bodies or we call the Splendor-Hopely phenomenon. So adding, no, meron po itong yeast cell natin and then it has radiations, okay? Eosinophilic materials that radiates, okay, giving it this asteroid appearance, okay? So that's characteristic of your Eschenki. Another is your fixed sporotrichosis. Yung kanina sa lymphocutaneous, madami tayong nodule. Dito sa fixed sporotrichosis, single lang and it's not involving the lymphatic. Okay? That it is also limited and less progressive. But this one is common sa Mexico. Okay? And sometimes it can cause also systemic illness. Okay? That's your fixed sporotrichosis. Again, the difference of your fixed sporotrichosis from your lymphocutaneous. Your fixed sporotrichosis has single nodule that is not associated or doesn't involve yung ating lymph. Okay? Primary pulmonary sporotrichosis, okay? Ito naman ay result ng inhalation ng ating Sporotrichia conidia. Okay? So it mimics chronic cavitary tuberculosis and tends to occur in patients with impaired cell-mediated immunity. So yung mga immunocompromised, immunosuppressed, okay, patients. So they can have this pulmonary sporotrichosis. So diagnostic test, again, we have biopsy or kuha tayo ng nana or exudate from the granuloma or ulcerative lesions. So examples of materials that we need, we have your KOH para makita natin yung tsura ng conidia niya. Or in the sections to view the presence of your fungus or the yeast cells, we can have your gomorimetenemine silver and your periodic acid shift. You have to remember your periodic acid shift stain is used to demonstrate carbohydrates, right, in your tissue. And do not forget about your fungal cell wall, which is rich in your polysaccharide. So that's why nagpa-positive din sila sa yung periodic acid shift. Okay, other than that, we can also use your serologic test. Example, your fluorescent antibody staining. So again, kung maalala nyo kanina, sabi natin, we have what we call the Splendor-Hopely phenomenon, where we have your asteroid body, the yeast cells with radiations or radiating eosinophilic material. So we can demonstrate them using your H&E staining, okay, technique. Okay, so the most reliable method for the diagnosis of your sporotrichosis is, of course, culture. Okay, so we observe presence of that leathery consistency culture. Okay, and then we can also have it strict in inhibitory mold or in your SDA, incubated at 25 to 30 degrees Celsius. And another is, of course, the identification at 35 degrees Celsius, where sabi natin pwede nating ma-convert yung mycelial form to your yeast form basta meron tayong addition, okay, nung inyong blood and carbon dioxide. So that's a confirmatory identification for your sporotrichosis. Okay? Thumbs up po if nakuha ninyo yon. Again, sabi natin kanina, yung mycelial form ng sporotrix, pwede nating i-convert to its yeast form. Okay, so the conversion is done at 35 degrees Celsius and it's said to be confirmatory identification for your sporotrix. Okay, pero the medium, of course, kailangan nating mag-incorporate ng blood and also carbon dioxide. Okay, and also we can use serological tests. Okay, example, the use of your latex particles and to detect now antibodies in the patient's serum. Okay, so pwede nating gamitin. So you'll get to discuss this adding pagdating nyo rin sa immunoserology ninyo. Okay? Kasi in serology, you will discuss there the different serological tests used to detect no fungal, bacterial infection. Okay? Ito lang yung sinasabi po niyan. So treatment for your sporotrichosis, it's self-limiting, okay? So minsan gumagaling siyang kusa or when treatment is needed, we can have your itraconazole or other azoles or oral administration of your potassium iodide. Pero in systemic disease, like for example, yung sabi natin kanina, hindi lang granulomatous lesion sa skin. Pwedeng mag-cause siya ng pulmonary sporotrichosis. So in that case, we use your amphotericin B. Okay? So that's your sporotrichosis. So epidemiology, again, it occurs worldwide. Okay, saan? Kung may mga saan may sphagnum moss, rose, decaying wood. Okay, tas natusok tayo, so pwede tayo magkaganon. Okay? So incidence is higher, of course, in agricultural workers like forest rangers, horticulturals. And syempre, to prevent getting the infection, we have to protect ourselves. So example, kailangan gumamit ng fungicide kasi minsan sa mga halaman na yan, nandyan sila. O kaya naman, we always have to wear yung shoes natin or pag pumunta ka siguro sa mga uh, ma, magubat, okay, na lugar, madaming halaman, you have to make sure na meron kang pajamas or naka-long sleeves ka. Okay? But you also have to remember even plants, they can have fungal infection. Kaya minsan nga, di ba, other than the fertilizer, we use also fungicide. Lalo na guys yung mga halaman, they don't like, most of the plants, they don't like yung soggy or very wet, okay, na soil. Kasi nabubulok yung kanilang roots. So, mamamatay yung halaman po natin. Okay? So that's your sporotrichosis. Next, we have your chromoblastomycosis. Guys, katulad nung sinabi ko kanina, di ba we have your Tinea nigra, okay, your Hertae wernicke, and your Black Piedra, your Piediara hortae. They are demacious. Also, these fungi, yung mga nagkukos po ng chromoblastomycosis, they are demacious fungi. All of them are septate. Ibig sabihin, sabi natin, pag septate, yung kanilang hyphae merong cross walls. And since they are demacious, pigmented yung kanilang hyphae. Time's up if nakuha po natin yun. Okay? So that's your chromoblastomycosis. Again, paano natin ito i-discuss? Tignan muna natin kung ano ba yung manifestation ng chromoblastomycosis. And just like in your dermatophytes, we'll just have to describe ano yung itsura ng mga organisms na to sa microscope and also yung kanilang colonies sa ating culture media. Okay? So again, you have to know yung kanilang distinct characteristic features. So chromoblastomycosis is an infection of the skin and the soft tissue. And the pathognomonic entity is your sclerotic bodies. So nakakakita tayo ng sclerotic bodies sa infected tissue. And that is diagnostic of your chromoblastomycosis. Okay? And distinguished by the formation of verrucous plaque or nodule at the site of inoculation with healing areas. So the mode of transmission, we have just like yung nauna, puncture wound or traumatic skin by contaminated vegetation. Again, sa mga mahalaman, 'di ba, magubat, okay, na lugar. Okay? So common etiologic agent, guys, always keep reading the names para ma-memorize nyo even the spelling. So we have here your Phyllophora verrucosa, your Fonsacea pedrosoi, Cladophylophora carioni, Fonsacea compacta, and your Rhinocladiella aquispersa. Okay? Tandaan, all are demacious and septate. Septate, ibig sabihin, may crosswalks, yung kanilang hyphae. So morphology, generally, colonies are compact, deep brown to black. Bakit deep brown to black? Kasi nga, they are demacious. Okay? And develop a velvety, often wrinkled surface. And in your tissue, they appear to have producing spherical brown cells we term them your muriform or sclerotic bodies. So these are your sclerotic bodies. Okay? They are melanized, so brownish yung kulay po nila. Okay? So pag nakakita tayo nito, this is diagnostic, okay, para sa ating chromoblastomycosis. Cells within superficial crust or exudate may germinate into septate branching hyphae. Okay? So may invasion. So first, okay, microorganism causing your chromoblastomycosis is your Phyllophora verrucosa. Phyllophora, tandaan natin yung phyllides. Okay? First, we have no, yung itsura po nila sa ating culture media. The colonies, they are olive gray to black, dome-shaped, woolly, or cottony. Okay? May umbok o kaya they're cottony. Black yung kulay or gray kasi nga they are demacious. Pigmented po yung kanilang hyphae. Okay? And in the microscope, are we going to describe yung kanilang appearance? They have septate conidiophore. Di ba yung conidiophore adding the hyphae? Okay? And this is your phylloconidiophore because it is what? Flash shape or cup shape. Hence the name Phyllophora. Okay? And we can see here clusters of conidia. Ayan yung kanyang mga conidia. Okay? So this one also. Okay? So that's your Phyllophora verrucosa. Remember, flash-shaped phyllide. Okay? That's the phyllide. Okay? With distinct collarette. Okay? Collarette daw yung appearance. Okay? And conidia near its tips. So flash shape yung phyllide tapos collarette appearance ng conidia. Yan, collarette. Thumbs up if nakuha po natin yon. So pag pinadescribe sa inyo, okay, yung conidiophore or the hyphae, it has no a flash shape phyllide. Okay? And if we're going to describe the conidia, they are collarette. Okay? So that's your Phyllophora verrucosa. So next we have your Fonsacea pedrosoi. It's a polymorphic genus. So just like no yung nauna kanina, ano yung makikita natin sa mga isolates ng pedrosoi? There are also phyallides, flash shape, okay? Conidiophore. Meron siyang chains of blastoconidia just like your Caladosporium, Apiospermum mamaya. And sympodial rhinoclagella type conidation. Mamaya makikita nyo yung rhinoclagella. Actually, kamukha niya din yung kanina, yung collarette ni, tawag dito, Phyllophora verrucosa. Okay? Most strains of your F. pedrosoi form a short branching chains of blastoconidia as well as sympodial conidia. Okay? So, tignan natin yung itsura niya. May picture. Okay? So, for the colonies, they appear to be ground black, brown, gray, black, or olive gray, velvety, and cottony. Mapapansin nyo sa mga Demacious fungi, halos pare-pareho sila ng description po. Okay? Dark yung kulay po nila. Okay? Because of that pigmentation. So, next. Okay. So, here's an itsura of your Fonsacea pedrosoi. Okay? So, ganito din kasi itsura guys ng conidia nung ating tao dito. Wait lang guys. Bakit? Okay. So, ganito din kasi, okay, yung itsura nung rhinoclagella natin. Okay? So, parang kanina din, yung mga Phyllophora verrucosa nyo, okay? Para silang collarette. And again, look at the colonies. They are dark in color po sa ating mga agar plates. Okay? After all, sabi natin, they are demacious. So your Fonsacea pedrosoi, okay, appear to have dark septate hyphae with primary mycosis conidia, okay? And then other than the primary conidia, meron siyang secondary and tertiary conidia. So in short, nagbabranch po yung kanyang mga conidiophores. So napansin natin, meron siyang conidia dyan, tapos meron pa doon. So branching, okay? Maliban dun sa naka-attach lang dito sa phyllide niya, meron pang nag-branch from the next conidia. Okay? So that's your Fonsacea pedrosoi. And then we also have your Fonsacea compacta. Kamukha siya ni Pedrosoy ninyo, but it has blastoconidia that are almost spherical with broad base. And then kung makikita natin, they are smaller and more compact than your F. Pedrosoy. Okay? So, grabe, compact. Okay, yung conidia, yung ayos ng conidia niya. Okay? So, that's your Fonsacea compacta. Another microorganism causing your chromoblastomycosis is your Rhinocladiella aquispersa. Okay? So, it is a sympodial process. Ano po yung sympodial process? These ones here. Okay? They are very lengthy compared dun sa conidiophore kanina nung iba, medyo maiksi lang. Okay? Ito sobrang haba po nila. Okay? So these are lateral or terminal conidia from a conidigenous cell or your sympodial process. Okay? So for your Rhinocladiella aquispersa, the conidia, they are elliptical to clavate. Okay, yung itsura po nila. So you look at this, they are elliptical. So that's the Rhinocladiella aquispersa. And then another microorganism causing your chromoblastomycosis is your Cladophyalophora carioni. Okay, so it has a branching conidia or chains of conidia, and we call them your acropetalis or yung mga distal budding po niya. Okay, so terminal conidium of chain give rise to next conidium. So parang nagbabud yung mga conidia niya. Okay, so microscopically, they appear to have elongated dark conidiophores with long branching chains, okay, of oval blastoconidia. Kasi nga, sabi natin, nagbabud yung kanyang mga conidia. Okay, and with septate hyphae. So, this is the itsura of your cladosporium. Okay, so ito yung mga conidia niya, pero nanganak pa ng madaming conidia, tas nagbabranch pa sila. Okay, so that's your cladosporium. Okay, and also we can see here, no, yung itsura po, okay, nung mga elliptical, okay, na conidia. So that's your cladosporium. So next. Okay. So for your Cladosporium carioni, ano pong itsura, okay, nila sa colonies? They are velvety. Again, just like the others, they have olive to black colony. Okay. So next, we have your pathogenesis and clinical finding. So ano naman yung clinical finding natin in your chromoblastomycosis? Okay. So sabi niya guys, no, fungi are introduced by skin trauma. Okay? So ang common, again, just like yung nauna kanina, yung at ating mga paa, extremities, okay, yung common po na nagkakaroon ng infection. Okay? Primary lesions can become verrucous or wart-like. Kanina nakita nyo yung itsura ng verrucous, para siyang crumpled or wrinkled. Parang itsura din ng mga colonies. Or yung cauliflower na lang. Kung nakakita na kayo ng cauliflower, di ba? Yung itsura po niya wart-like. So, ganun daw yung itsura ng mga lesions sa chromoblastomycosis. Okay? And we can also see presence of ulcerations or black dots that are hemopurulent. There are mixtures of blood and pus. Okay? And sometimes patients may experience secondary infection, okay, that results to elephantiasis. Diba, lumalaki yung extremity like the paa or the legs. Okay, in parasitology, you have microorganisms causing elephantiasis, right? Ano na nga yun sa para nyo? Pinagkakos ng elephantiasis? Sa filarial worm.
Bancrofty po atin.
Yeah. Yes, we have your Wuchereria, kay Bancrofty. Okay? So, ganun din. In your chromoblastomycosis daw, secondary infection may happen causing elephantiasis, okay, dun sa pasyente. Kasi usually sabi natin, yung nagkakaroon daw ng sakit ay yung kanya, or na-infection kako sana, ay yung extremities, okay? So, dissemination to other parts of the body is very rare, okay? And the lesions can be described to be satellite lesions, okay? So, don't forget the lesions, okay? They are granulomatous. Okay, usually naman sa mga subcutaneous infection natin, lagi yan granulomatous. They are what? With presence of sclerotic bodies. Okay? So that's no an entity seen in your chromoblastomycosis. So don't forget about your sclerotic bodies. So for diagnostic laboratory tests, we do skin scrapings of the lesions or biopsy. And syempre, i-observe natin siya sa 10% KOH. So ito daw yung itsura ng ating sclerotic body. Napansin ninyo, they're like budding yeast din. Tapos, may septum or cross wall, between those two bodies. Okay? So, detection of your sclerotic bodies is diagnostic of your chromoblastomycosis. So, they are copper-colored septated cells. So, may separation sila. Okay? So, culture media, inhibitory mold can be used, mold agar and your Saboros dextrose agar with antibiotic. Okay, for chromoblastomycosis, what is the treatment of choice? We have your surgical excision. So we remove the lesions, okay? Or we can have chemotherapy with flucytosine or itraconazole for larger lesions. Or sometimes what they do is to apply local heat. Pinapaso nila, okay? But sometimes bumabalik, okay, yung infection. So how are we going to prevent ourselves from contracting yung chromoblastomycosis and other types of subcutaneous mycosis? We have to protect, okay, our feet by wearing shoes or our legs by wearing pajamas or yung kamay po natin by wearing long sleeves, okay? So that's for the treatment for your chromoblastomycosis. Epidemiology, again, they're mainly in the tropics, hot, humid, warm, environment. And again, they are not communicable. Hindi katulad ng mga epidermophytons mo and other dermophyte infection na naililipat, okay, or nahahawa tayo. Ito hindi. Kasi ang mode of transmission niya, pag natusok tayo nung thorn or maybe infected material. Okay? So the fungi causing your chromoblastomycosis are saprophytic and they are found syempre in vegetation and in soil. So the disease, of course, are chiefly on the legs of the barefoot agrarian workers. Example, mga farmer din, di ba? Kasi naman no, pag magtanim tayo or we're in the field, ang hirap kaya pag nakabotas ka. So they prefer not to wear anything kasi para madaling lumakad. Okay? So that's the epidemiology for your chromoblastomycosis. Thumbs up if nakuha po natin yung chromoblastomycosis. So true or false? The lesions in your chromoblastomycosis are granulomatous. In the chat box, true or false? Yes, di ba? Lahat sila actually, most of them na mga subcutaneous mycosis. Okay? Another question. Give me, okay, the diagnostic marker for your chromoblastomycosis. What can we observe in the lesions that can tell us that, okay, the patient actually has chromoblastomycosis? Ano na ang tawag niyo doon? We have your, yes, sino ba to? Si Miss Agpalza.
Ma'am, for the diagnostic of chromoblastomycosis po is detection po ng sclerotic bodies.
Yes, detection of your sclerotic bodies. Okay? So next. Next is your phaeohyphomycosis. So adding yung phaeohyphomycosis ninyo, ganun din po, katulad po nung ating chromoblastomycosis. Most, if not all of them, most of them are demaciaceous. Okay, your Hexaphyalogen celmae, okay, your Wangela, your Bipolaris, Culvaria, Alternalia, Drusella, and Exorilum. Okay? Though your Phyalophora, I'm not certain kasi pero parang it's described to be hyaline. Okay? So that's for your phaeohyphomycosis. Ang tawag sa infection na kinukos nila ay phaeohyphomycosis. Okay? So just like yung ating chromoblastomycosis then kanina, these are exogenous modes. Okay? They normally exist, okay, sa ating environment or sa nature po natin. Okay? So your phaeohyphomycosis is characterized, okay, by darkly pigmented septate hyphae. Kasi sabi nga natin, the microorganisms causing it are demaciaceous. Okay? The clinical forms vary from solitary encapsulated cyst in the subcutaneous tissue o kaya naman meron tayong brain abscess. Okay? So merong brain abscess. So even the CNS can be affected. Okay? So next, example under this is yung Cladophora banshiana ninyo. Okay? So your phaeohyphomycosis, example of causative agents, we have Exophiala ginselmae, Phyllophora ricardsae, Bipolaris, and your Wangella dermatitis. Okay? And another, okay, that cause naman cerebral phaeohyphomycosis. Sabi natin last time, di ba? Demacious fungi na nagkukos ng brain abscess. Okay? It's your Cladophyllophora banshiana. So do not forget about this. The demacious fungi that cause now cerebral abscess or brain abscess or cerebral phaeohyphomycosis, it's your Cladophyllophora banshiana. Okay. So in tissues, the hyphae are usually large and sometimes distorted. The drug of choice for your phaeohyphomycosis is itraconazole or flucytosine, but in patients with infection caused by your Cladophyllophora banshiana, we have your amphotericin B, okay, for brain abscesses. So first, microorganism causing your phaeohyphomycosis, we have your Exophiala ginselmae. Okay? So, katulad din nung kanina sa chromoblastomycosis, nakita nyo, halos pare-pareho po sila gray to black, olive to black, cottony, woolly, kasi they are demaciaceous. Okay? So, they grow at 37 degrees Celsius, but not at 40 degrees Celsius. That's your Exophiala ginselmae. Okay? Next, in microscopic exam, they show pale brown conidiophores that form cylindrical annelids. Okay? And they have no conidia at tips of their annelids. And then another is your Wangella dermatitidis, another agent of phaeohyphomycosis. So ganun din guys, dark olive color kasi demaciaceous siya. Okay? Unlike kanina yung sa ginselmae ninyo, your Wangella dermatitidis grows at 40 degrees Celsius. While your Exophiala ginselmae, it only grows at 37 degrees Celsius. Okay? Next, okay, sa microscopic exam, it shows now presence of dark budding yeast that develop tube-like phyalides. Okay? So, walang colarets, wala yung parang mga ganyan, okay, na conidia niya, and no annellations. And the next, another that caused no phaeohyphomycosis, we have your Phyllophora ricardsae. So, it also produce phyalides. Ito yung clue nyo. Parang yung Phyllophora verrucosa kanina. Okay? So, may phyalides po siya. Okay? So, we also have your bipolaris. Okay? Same then, dark, okay, brown and slightly powdery colonies. Similar with your Dreschlera and your Exorillum. Okay? So, they are also causing phaeohyphomycosis. So this is a picture of your bipolaris. It's a demaciaceous fungi. Look at that. It's brown in color. Okay, it has multi-celled conidia. So these are the conidia. And we can see here, no, sympogely, we can see the conidia in a geniculate conidiophore. Geniculate, ibig sabihin nag-bend. Bend, okay, yung kanyang conidiophore. Okay? And we can see septate hyphae. Okay? So that's for your bipolaris. So for the microscopic appearance, again, kanina nakita nyo naman na yung picture niya, meron siyang conidioform that is bent or geniculate. Okay? And then we also have your curvularia. Yung curvularia natin, okay, in the culture media, ganun ulit. It's fluffy or downy and olive gray to black. Okay? It's also damacious. So this is the appearance of your curvaria under the microscope. It shows no a conidiophore, okay, that is twisted. Ito yung conidiophore, okay, na-twist siya. Ito. Yan. Parang nabali-bali siya, okay? And then we can also see the conidia with a swollen central cell. So this is the conidia and may swollen central cell sila. Kamukha niya yung isang tinapay na kinakain natin, crostini. Diba? This one, oh, swollen yung central cell po niya. Okay? So it looks like a crostini. Okay? So again, the conidiophores for your curvularia is also geniculate or bent. And don't forget about the swollen central cell at the conidia. Okay? That's your curvularia. And then we also have your alternaria. The colonies in the medium, same. It's gray to brown or gray-green. And then, ito yung tsura niya under the microscope. So, makikita nyo yung chains, okay, of conidia. So, we can see here, no, chains, okay, of your demacious conidia, okay? So, it has hyphae that is septate and also a golden brown pigmented conidiophore. Sabi kasi natin, it's demacious. Okay? Don't forget, okay, about the conidia that resembles drumstick. Okay, drumstick. So, the conidia, okay, resembles your drumstick. Okay? And then we have your Dreschlera. Okay? So sa microscopic naman, ang Dreschlera ninyo ading, kamukha niya ng appearance yung Exorilum, okay, kanina, yung bipolaris. Pero sa microscopic exam, ganito po yung itsura niya. Okay? So it is also demacious and it shows no geniculate conidiophore, bent din yung conidioform niya just like yung mga naunang dalawa. And they are produced sympodially. So mapapansin natin, it has a sympodial process, okay? This one, from the hyphae, merong malaking process at doon natin makikita yung conidia niya. Okay? So that's your Dreschlera. Okay. And then we have your Exorilum. Okay? Mukhang parasite. Parang fluke yung itsura niya, okay? So its hyphae is also septate and demacious. And then the conidia, okay, they're described to be elongated and ellipsoid. Okay? That's your exorilum. So those are the different microorganisms causing your phaeohyphomycosis. Okay? So true or false? Microorganisms that cause phaeohyphomycosis are melanized or pigmented or have pigmented hyphae. True or false? Yeah, Miss August.
True po, ma'am.
Yeah, because they are demonstrations. Okay? So next, other than your phaeohyphomycosis, you also have to take note that some of those microorganisms causing phaeohyphomycosis also cause another type of subcutaneous infection, and this is your mycetoma. Example, we have your Exophiala ginselmae, your Colvaria, okay, di ba? And other microorganisms that may cause mycetoma. We have your Pseudoleskeria boydii, Madurella mycetomatis, Madurella grisea, your Exophiala, your Culvaria, and your Acremonium falciforme. Adding note, tatandaan natin, meron ding mycetoma sa bacteriology, right? We have your actinomycetes causing your mycetoma. Okay? This is of course caused by your bacteria, right? Your actinomycetes. Okay? And usually mas invasive po ito kesa sa mycetomas mycetoma na kinukos nitong mga fungi natin. For you, we also call it your mycetoma. Okay, or sometimes called as Madura foot or yung Madura mycosis natin. So, syempre, ang causative agent natin ay yung mga fungi na nabanggit natin and hindi siya less invasive siya, okay, compared dun sa ating bacterial counterpart, okay, or the counterpart caused by your invasive, okay. So, again, actino, sorry for the spelling, actino. Okay? So we have your actinomycetoma that's caused by your bacteria. It's more invasive compared to your mycetoma or eumycetoma, or also known as your Madura mycosis, your Madura foot, that's caused by your fungi, especially those that are listed here. Okay? So again, katulad din po okay nung ating chromoblastomycosis, your phaeohyphomycosis, adding no yung mga mycetoma causing microorganisms natin, they are also demacious. Okay? Except for one. Mamaya makikita nyo, meron sa kanila na hyaline. Okay? So, ganun din, just like other subcutaneous infections like your Sporotrix, your chromoblastomycosis, and your phaeohyphomycosis, yung mycetoma, it's also caused by traumatic inoculation. Same pa rin, yung mga fungi, they thrive dun sa mga areas na mapuno, mahalaman. Okay? So, mycetoma is a localized chronic, okay, granulomatous infection characterized by formation of painless subcutaneous mass of chronic onset, and then there's multiple sinus draining pus and grains. Okay? Most often, confined sa hand at feet. Okay? Same din dun sa ibang mga subcutaneous mycosis. So it's also called your Madura foot, Madura mycosis, or eumycetoma. Again, mode of transmission, same, contaminated soil-laden materials that cause injury, just like a splinter, a thorn, okay, or other contaminated sharp objects, okay, from the environment. So agents that cause, we have your Pseudoleskeria boydii. Your Pseudoleskeria boydii is the teleomorph, okay? This is the sexual form. And the asexual form is called your anamorph, and that is your Scedosporium apiospermum. So sabihin, this one produces your asexual spores, while this one is of your asexual. Thumbs up if nagets po nyo yan. Are you still there? Okay? So others, we have Madurella mycetomatis, Grisea, your Exophiala ginselmae, and your Acremonium. So guys, no, most of the microorganisms causing mycetoma are slow growers. Okay, they require up to 4 weeks or more para magkaroon po ng growth dun sa ating mga medium like your SDA. Okay, first we have your Pseudoleskeria boydii. Your Pseudoleskeria boydii is the teleomorph, and your anamorph is your Scedosporium apiospermum. Okay, so it's self-fertile. It's said to be homothallic. Okay, other than causing po mycetoma, it also causes your pseudolesceriasis. So guys, if we're going to describe the granules found in the mycetoma with your Pseudoleskeria boydii, ang kulay po ng granule niya ay kulay white. Okay? Kulay white. Okay? Because your boydii, unlike the others, like for example, yung Madurella ninyo at Exophiala, demacious. Okay? Though sabi natin, most of the microorganisms are just like those causing your chromoblastomycosis and pheo, pero hindi po lahat sila ay demacious. Okay? Example, this one. Okay? So, ang granule niya ay white color. Okay? That's for your Pseudoleskeria boydii. So, the appearance, it's white to gray fluffy colony that usually no turns gray or mousy gray. And the reverse side, yung reverse side, ibig sabihin pag binaliktad mo yung agar plate sa likod nun, ang kulay niya ay tan to brown or black color. Okay? So for the microscopic appearance, the teleomorph is said to have sac-like Cleistotitium. Malala nyo to sa drawing din ninyo. Diba? It has ascospores. Okay, the aside that contains now your ascospores. Okay, and in the anamorph, yung Scedosporium apiospermum, ang itsura niya ay elliptoid, okay, with single-celled conidia sa tip ng ating conidiophore. So that's your Pseudolesceria boydii. Tatandaan ninyo when we're talking about Cleistotitia, yan po si Pseudolesceria. Okay? So, another anamorph. Maliban po dun sa Scedosporium, may anamorph form pa rin siyang isa. We call this your Graphium stage, which is less common. Okay? And it's referred to as your Coremia. It has that structure called Coremia. Okay? So, note your P. boydii is resistant to your Amphotericin B. Another microorganism causing mycetoma is your Acremonium. So, adding sabi natin, not all organisms causing mycetoma are demacious. Hindi katulad nung sa chromoblastomycosis natin at your, hyphomycosis. Okay? Ito, your Acremonium is a hyaline by fungi. Okay? So, it also has no intercalary, calari, and terminal chlamydoconidia. So, when we say intercalary, di ba? Nasa gitna yung kanyang chlamydoconidia. Terminal nandun sa dulo, okay? So that's for your Acremonium. Colonial appearance, it's white to olive brown, okay? And sometimes the brown pigment is also diffusible. Another is your Exophiala ginselmae. So hindi niya na diniscuss kasi your Exophiala ginselmae is also one of the fungi, okay, causing phaeohyphomycosis. Okay, it's a demacious fungi. So with your Corvularia, okay, it also causes your phaeohyphomycosis. So nagkakos din siya ng mycetoma. So clinical findings in your mycetoma, there's subcutaneous tissues of the feet, lower extremities, hands, and other exposed area. Kaya sabi natin, to protect ourselves, gamit tayo ng boots, ng pajamas, long sleeves. Okay? Pathology is characterized by suppuration and abscesses and granuloma. Okay? So it may spread to contiguous muscle and bone. So, pwede magkaroon tayo ng lesions na papasok hanggang sa buto. Okay, lalo pag hindi natin na-treat. Okay? And don't forget, for all the those microorganisms causing mycetoma, your Pseudolesceria boydii can also cause disseminated infection in immunocompromised patients, especially those with cardiac pacemaker. Okay? So that's your Pseudolesceria boydii. Maliban sa nagkukos siya ng mycetoma, okay, lesions in the extremities, it can also cause disseminated infection. So lab diagnosis, ganun din, just like yung iba natin kanina, we get to see yung granulomatous lesions niya. Okay? So the granule color, texture, and the size can also be described. Okay? Pwede kasing hyaline or pigmented yung hyphae, okay, ng microorganism na makikita po natin doon. Okay? So for this diagnostic laboratory, di ba maalala nyo kanina sabi natin, there are those that cause white granules, meron naman nagkukos ng black granules. Okay? So for white granules, ano na nga yung example natin kanina? Okay? We have your Pseudolesceria boydii. Okay? White yung granules po. And then also your Acremonium falciforme. Okay? So sila po nagkukos ng white granules sa lesions. Okay? Because they're hyaline. Okay? While those that cause naman black granules, okay, sa lesions po natin, we have for example, okay, yung inyong M. grisea, okay, Madurella, okay. And then we have your Exophiala ginselmae or your E. ginselmae. Okay. And then another is dark red, okay, to black granules. Example of dark red to black granules, we have your Madurella mycetomatis. Okay? Mycetomatis. Okay. So, again, characteristic granules, colors of granules, okay, in your mycetoma. Okay? Pwedeng white yung granule. Example, we have your Pseudolascheria boydii and your Acremonium falciparum. Or forme, I should say. Biglang naging parasite. And then black granules for your M. grisea and your Aegean May. And then we have your dark red to black granules for your M. Mycetomatis. Okay? Or your Madurella mycetomatis. Okay? So that's for your mycetoma. Next. Okay, management and treatment, pwedeng removal, okay, like debridement or excision. Or we can have no treatment with your antifungal drugs. Example, for your Pseudolascheria boydii, we have your topical nystatin or miconazole. O kaya naman for Madurella infections, yung kinukos ng Madurella mycetomatis natin or Madurella grisea, we can have itraconazole, ketoconazole, and amphotericin B, and flucytosine for your Exophiala cinselmate. Okay? Ay, okay. So that's your subcutaneous, okay? Mycosis. Nakuha po natin. Hello. Andyan pa ba kayo? Hello. Okay. So let's have a quick recap in the chat box. Okay, you give me the 4 diseases, okay, under subcutaneous mycosis. So what are the 4 diseases under or four groups of mycosis under your subcutaneous mycosis? In the chat box, di ba we have 4? Okay, ano yung mga yon? Yes, Rovin.
Ma'am, we have phosphotrichosis, chromoblastomycosis, pheohypomycosis, tsaka mycetoma po, ma'am.
Okay, so sporotrichosis, chromo, pheo, and your mycetoma. Okay, so how are we going to describe the lesions in your subcutaneous mycosis? They're said to be what? Yung mga lesions dun sa ating um, subcutaneous, they are described to be, yes, Miss Geeking.
Granulomatous po, ma'am.
Yes, they are granulomatous. Okay? And kanina, we are describing, okay, the granules, okay, found in the lesions, okay, in your mycetoma. Okay? So in the chat box, I want you to give me a microorganism that gives or that or microorganisms, I should say, that cause now white granules, okay, in your mycetoma lesions. Diba, we have to, kaka-name lang natin kanina. Ano yung mga yon sa chat box? Yes, Miss Irish.
Ma'am, Pseudolascheria boydii, tsaka Acremonium falciforme po.
Okay, very good. How about your mycetoma agent that's causing appearance of black granules? Mhm. We have black granules in your mycetoma. Yes, Miss Kyrie. Kyrie?
Ma'am, it's Madurella grisea po, tsaka Exophiala genselmate po.
Okay, yes, you're correct. Okay, so next, true or false, your Sprotrich-Schenke infection is limited only to your skin lesions. Ibig sabihin ba yung Sprotrich-Schenke doesn't cause systemic infection? True or false? True or false? Does it cause systemic infection? True or false? Or can it cause systemic infection? True or false? Yeah, Mr. Katulin.
Ma'am, false po, they can cause systemic infection po in the case of pulmonary sporotrichosis po.
Yes, very good. Okay. In the case of your pulmonary sporotrichosis, that's no systemic. Okay. So next, balikan natin yung sa may Malassezia furfur. Okay. True or false? In the detection of your Malassezia furfur, example, infection with your Pityriasis versicolor, culture is usually not recommended, or culture is not usually required. True or false? In the laboratory diagnosis of your Pityriasis versicolor, culture is not usually required. Yes or no? Yeah, Miss Panganiban.
Ma'am, true po.
Yes, okay. Pag tandaan nyo, in your Malassezia furfur, culture is not usually required, lalo na adding kapag ang infection natin ay skin infection. The manifestation in the skin alone can give you an idea na, okay, that can be caused by your Malassezia. So we do direct examination, like for example, KOH preparation. Okay? So next, is your Malassezia for capable of causing systemic infection? Yes or no? Yeah, Miss Romela.
Yes po, ma'am.
Yes, okay? So sabi natin, it can cause infection, especially fungemia, right? To patients, no, undergoing what replacement therapy? Nutrient replacement therapy. Again, ano na nga kasi? Saan na kasi siya commonly nagkakos ng fungemia? Sa mga patients, no, administered with what nutrient replacement therapy? Yes, Miss. Pare-pareho lang yung nagre-recite. Anong nangyari dun sa iba? Yeah, Mr. Baginon.
Ma'am, lipid replacement therapy po.
Yes, especially those that are contaminated with your Malassezia. Okay? So guys, no, that's for your superficial, your cutaneous, and your subcutaneous mycosis. Next, just review, okay, lab diagnosis hanggang kay cutaneous lang. Maiksi lang naman actually yung cutaneous. Ang nagpabalang dun is yung name nung mga infection like your tinea, right? Pero pagdating mo sa superficial, 4 lang yun. Alam mo na lang yung 4, tapos ka na. Actually, yung superficial mycosis, 15 minutes lang na review mo, kabisado mo na yun. Okay? So please review lab diagnosis, superficial mycosis, and your cutaneous mycosis. Hindi ko sure kung maibibigay ko yung exam next week kasi nga ang problema natin ay schedule nyo. Pero you just have to prepare kasi I might give it on a on a Thursday or Friday. Okay? Kasi tatanungin ko pa yung ibang teachers nyo kung pwede ako makiusap. Pero kung hindi ko man maibigay, baka sa susunod na week. Okay? Kung pwede, baka aswan kayo. Lahat kayong third year. So I'll just inform you. Pero ngayon pa lang sinasabi ko na anak, na you have to review your lab diagnosis, your superficial, and your cutaneous. Hayaan nyo na muna yung subcutaneous. Okay? Later na lang yon together with the remaining topics. So I will see you guys, no, next Friday ulit for another lecture. That will be the last lecture. We have your opportunistic and systemic. Okay? So sa systemic, 4 lang din ulit yon. Diba? We have your histoplasmosis, paracoccidioidomycosis, ganyan. Okay? Coccidioidomycosis and blastomycosis. Okay? So then after that, opportunistic na po tayo. Okay? Ready for your midterm exams. So I hope na download nyo na rin po yung mga review materials. So that's a combination of Jawets, of your Baileys and Scots, and other na materials na nagamit ko before. Hindi ko na kasi maalala kung ano yung mga yun. Kasi way back 2017 pa. Okay? So please review po yung mga lecture notes ninyo. And again, how are you going to review that? You have to know kung ano yung manifestation, clinical manifestation nung mga mycosis natin, ano po yung mga microorganisms na nagkukos, at ano yung laboratory identification technique for each of the microorganism. How do they appear in your culture media and how do they appear in your microscopic exam? So when we say microscopic exam, that's direct examination with your slide, like we do addition of your potassium hydroxide o kaya yung inyong calcofluor white stain, if you still remember that, di ba, sa lab diagnosis natin. Okay? Thumbs up kung nakuha po natin yung mga instruction. Do you have questions po or do you have problems na ma-address natin sa subject po na to? Wala naman? Okay. So that's all po. Yung mga naghihima 1 and 2, nandito na din sila, di ba? Kasi wala naman kayong pasok today. Tama po?
Yes po, ma'am.
Okay. So don't tomorrow hindi na po tayo magmi-meet kasi kung hindi kayo ngayon nag-attend, yun sana yung topic natin. Since you're here, we're fine. Okay? So guys, no, kung wala na pong tanong, okay, that's all for this afternoon. Thank you for cooperating and I am sorry din, okay, if there are times na nawawala yung boses or husky yung dating po niya. Okay? Pero in fairness, medyo okay na siya. Unlike yesterday, talagang paus na paus po ako. Okay? Since actually last week, kasi meron akong sore throat for how many days. Pero ngayon, yan, naging ano siya, namamalat. Okay? So maraming salamat po. I'll see you next week. I'll wait for announcements po para dun sa quiz. Just please know, review well. Isipin ninyo, you're not just reviewing for the quiz, but you're also reviewing para sa midterm exams ninyo. Guys, don't forget, pagbalik nyo from Holy Week vacation or break, midterm exam na ninyo. I think mycology is second day po ata. So mayors, please check that and inform your classmates. Nakapost na rin sa page natin yung exam schedule. Okay? So it's still 100 items, multiple choice. Read, okay, yung libro ninyo. Read yung mga notes po ninyo. Okay? Maraming salamat po. Goodbye. Ay, wait lang pala. Sige, open nyo pala yung cam nyo, sorry. Kasi today, hindi ako nag-report ng school para makafocus ako dun sa discussion natin. Kasi syempre pag nasa school ako, maya't maya may mga students na nagvi-visit at may mga kukuhanin, ganun. So, nai-interrupt tayo. Other than that, hindi